So, yeah, Bill Hill, Nash County Health Director, been there for as long as I can remember anyway. And but being as young as I am, that's not been very long. Look, tell us a little bit about what's going on in the country. I've noticed measles outbreaks in places like Detroit and Philadelphia, and gosh, I thought that was all gone. So, what are you dealing with, and what are you seeing out there in terms of flu and other outbreaks?
Yeah. Measles should be eradicated, and it just about was. And measles is a serious illness. It can be a killer. It can seriously cause problems like encephalitis. It can cause a lot of other really, really serious problems. But measles, the good and the bad. The good is with the immunization that your children should receive, first and second dose, is about 97 to 99% effective.
Okay.
You can't say that about a flu shot. You can't say it about a COVID vaccination.
That's about as good a deal as you get in anything, ever.
That's about as good a deal. So measles will target the unvaccinated child.
Okay.
And so I urge all the parents, and of course the school system's working with us on this very thing. Once you get in school, it's a requirement to get the measles shot. It's an MMR, it's measles, mumps, and rubella, but it's a combination shot. I was just reading the other day, if you just get the first shot, you're about 93% effective.
Okay.
And you add the second shot between 4 and 6 years of age.
Right.
First shot after 12 months, between 12 and 15 months. And then the second shot between 4 and 6 years of age. You get that immunity level up to about 98, 99%.
Wow.
You prevent measles, otherwise.
Wow. No question.
We have not had a case in North Carolina.
Okay.
Right. Recently, but we've had 58 cases that we're watching across the country. Have seen it in the European countries, Austria, Great Britain, and some of the other countries in Europe are seeing much measles, a fairly high prevalence of measles.
Okay.
But that's something we want to prevent, and you can prevent it again with the immunization.
So, what do you think has been causing the outbreaks? I mean, that seems just it's largely gone away, and then all of a sudden now, boom.
I think that's the very thing, the lack of emphasis, the fact that we don't see measles anymore. We don't have that scare tactic anymore.
Right.
Gotten a little lazy with the precautionary measures like immunizations. But I think it's no doubt that measles targets the unvaccinated child.
Right.
So get them vaccinated. And, of course, schools dealing with that. But there are some exemptions. There's some real legitimate exemptions when you get into medical exemptions. But there are probably a tad bit more of the religious exemptions that become somewhat questionable sometimes as excuses.
Right.
Maybe not bona fide religious exemptions.
No, I understand what you're saying. And it's important, though, societally, that we try to control as many of these infectious diseases as we possibly can, particularly when we have tools, proven tools that have been around for almost generations now.
So glad you mentioned societal, because that's what we call herd immunity.
Yeah.
And we can create herd immunity. It takes a little higher percentage. Typically, we talk about 70 to 75% immunization or natural immunity with herd immunity. But with this very contagious a disease like measles, very, very contagious, you probably need to get the immunization rate up to about 95% to really get a good herd immunity.
Right.
We stand at about 88% with our children right now.
Okay.
We'd like to be at 95%. Right. And I would appreciate if parents would take heed.
Just need a few more to get them over the line, right?
Absolutely. And, of course, there are other shots that they will face. Sometimes our immunization rates stay low up until school age, and then the school requirement comes in there.
Right.
Gives them 30 days, and if they don't get them in 30 days, they have to go home.
Right.
And we met with the school system just this past week, the lead school health nurse, Deb Turrell, and our folks, and dealing with that very issue right now, trying to encourage and get information to the parents. Don't just wait till next August when you're getting ready to come to school, but start thinking about that as we approach spring and summer.
So we're right here in the midst of flu season. I know RSV was an issue a little bit earlier. What are you seeing in terms of outbreaks in the county and the area, or the state for that matter, related to a number of those issues?
We've been relatively fortunate with a relatively low prevalence of all those respiratory illnesses. When you look at COVID, when you look at RSV and flu, we've had a relatively mild season.
Right.
we look at metrics so much, especially as we were going through COVID. I kind of think back over the recent history of 2 to 3 years when we were pre-COVID, COVID, and the aftermath of COVID. But we look so much at the metrics like these 2 or 3: hospitalization rates, new cases, and deaths that would come from COVID during those times.
Right.
And that's when I was doing those teleconferences.
Well, and I was going to say, we haven't had a chance to do a postmortem on what I would consider to be the pandemic in Nash County and your involvement and in your team's involvement. I really thought you did a masterful job of managing the process that we were having to go through for COVID-19. In addition, and probably more importantly, or just as important, the communication that you and the county did in terms of disseminating information, how many cases we had, what the outbreak numbers looked like, general area, things that we needed to be doing, both individually and in terms of our scan of influence. And really, 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 really feel like you did a great job in all that. And I know that you're going to say it's somebody else.
It's somebody else. It's our county leadership.
Sure.
But I appreciate you saying that, Mr. Mayor. I'm especially appreciative of the way we got it into the media.
Mm-hmm.
We were able to do, and through those teleconferences, like yourself, elected officials, mayors of different townships, towns where they are municipalities. And this way, when we were doing them 7 days a week and even holidays, we just said COVID didn't take a break.
That's it.
So we did it all the time. Then we went to 5 days, 3 days, and then we did it for 1 day a week a lot. But we at least kept our citizens aware that, hey, we're still getting new numbers. We're still getting 300 or 400 cases, new cases.
I was going to ask, so what is that looking like now? Is 300-400 a month or day? Or
back to a peak,
yeah,
we saw 2,500 new cases 1 week.
In 1 week.
2,500.
In a population of about 95,000 people.
And and I was reporting deaths and a lot of hospitalizations and a lot of really sick people in the hospital on vents, ventilators, and respirators.
I remember the early stages of that. It was really very frightening for folks who had any touch of healthcare and understood the number of folks on vents. It was problematic.
It was, and fortunately now we're not seeing, when we check in with the hospital, the hospitalization rate is lower. What we have noticed, we're seeing still a few new cases, but they don't seem to be quite as acute, quite as sick, quite as severe as we've seen in the past that don't necessarily require hospitalizations. I think our 6 or 7 shots over the last couple of years probably helped, at least if it didn't prevent you from getting it, it probably made the case a little milder than it could.
Well, that's kind of the best you can do in any kind of virus, isn't it? I mean, the same thing with the flu virus.
That's right.
You're kind of hoping that you nail it right on the particular strand, but
that's right.
You're really just kind of hoping to minimize the impact.
That's right. And of course, those epidemiologists that are putting together the flu vaccine, they're doing it about 6 or 7, 8 months ahead of flu season. And it takes a real talent from an epidemiological standpoint to put it together in those 3 and 4 quadrivalent.
Well, I kind of like the old Johnny Carson routine, the Mighty Carmack.
That's right. That's right. When hermetically sealed.
That's exactly right. I know exactly what this is going to be.
I remember very well. But those are the kinds of things we looked at, and I think we're in a better time, certainly now. When we go back and look at COVID, though, at the very early days, we didn't have tools except old school tools.
Right.
We didn't have a vaccine. We were waiting for it. Here we were in March and April.
We didn't have N95 masks. We didn't even have adequate personal protective equipment.
That's right. And so as March and April 2020 came along, we were dealing with public health principles that dated back 100 years with the Spanish flu.
Right.
The 3 W's, mask, distance, washing hands.
Yeah.
And then we used terms like isolation and quarantine.
Right.
We hadn't used those in a long time, those terms. And we were waiting for the vaccine arrival, which came late December, right? We gave a few shots after Christmas of 2020, but then we hit the road running January 21 with Nash Central High School, where we gave 900 shots one day.
I know. My mother was in that line. You learned a little bit about that process, right? I mean, but
We learned a lot about that. That was we did a first come, first serve.
you got 950 people. I mean, that's a big number.
It was a big number, and unfortunately, we did learn a lot. Fortunately, but unfortunately, some folks waited 5 and 6 and 7 hours. And one of the things that we remembered thought about it last minute were porta johns.
Right.
We said, let's get 2 porta johns. We needed 10 or 12 porta johns.
2 is a start.
And we need the gas station nearby because folks were literally about to give out of gas and they didn't want to break from the line.
Well, no, I get it, because it was hard to come. I mean, initially, there wasn't just a vaccine for everybody. You had to be compromised in some sort of capacity, either really old or really young. Or
we were looking at prioritizing those.
And certain number of doses were given out by county and
very scarce.
It was very scarce, right?
And the first one was Pfizer, Moderna and Pfizer. But the first one at that particular event was Pfizer, which meant 21 days later, we had to see those same folks again.
Right.
But that's when we got it right.
You did. No. But look, you don't know what you don't know, right? I mean, you first come, first serve. Yeah, there's no way you could have considered 950 people be waiting in line.
Had no idea.
I mean, it's like when I was a little bitty child, I remember waiting in gas lines to get gas in 1970, whatever that was, during the oil embargo. And that's sort of what that was likened to. Everybody's just kind of waiting and waiting and waiting.
And the one thing we didn't want to do like that particular event, I was in Chapel Hill at the time, and you could wait forever and then give out a gas and not have the gas available to you. So we knew we only had 1,000 doses, and now we're at 900. And
Right.
So we had someone at the end of the line counting numbers and communicating back to us. The last thing we wanted to have is somebody wait 4 or 5 hours and not have the shot.
Can you imagine being that one guy at the end of the line?
Oh,
I'm sorry, no more soup today. You got to go home.
I would hope they didn't have a concealed weapon.
Shoot, I'm not sure. Anyway.
But we gave our last shot that night at 11:20 p.m. in 34 degrees. So, but we got through it, and then we alphabetized the list next time. That was easy. We knew who came. So we knew we could fit this number in 2 days, this number in the morning, afternoon, the next day, morning and afternoon.
And get it
and they waited 20 minutes the next time.
That's right. Well, and then you live and you learn.
Yeah.
And so, hopefully we will not need that kind of mass immunizations going forward in some time. But look, tell us a little bit about what the county health department does. I mean, you are responsible for a lot of stuff that I don't think folks really appreciate. One, it is about immunizations. You do provide those in various clinics, and that touches a lot of people. You're in charge of reportable incidents,
diseases
and other things. I mean, STDs and I mean, you manage a lot of stuff, and so I don't think a lot of folks really fully appreciate the depth and the breadth of your role as the director.
Well, thank you for saying that, Mr. Mayor, but it's really the team I have that works for us.
Somebody had to build a team, Bill.
Well, thank you for that, too. When you talk about childhood and childhood immunizations and well baby clinics, they're obviously a big part of what we do in both our Rocky Mount City office.
That's right.
And our Nashville office. Both are Nash County Health Department offices, but one downtown Rocky Mount, right on Franklin Street,
and we're
right
thankful
here.
For that. Thank you very much.
And we see a lot of patients there.
Right.
When you look at the caseload, we used to say it was just about 50-50. We drew from the population of Rocky Mount, Whitakers, and Brattleboro here, but now we're probably seeing 55 to 58% of our patients in our Rocky Mount office.
Oh, really? Okay.
We do a lot of maternity care.
Okay.
And we have Nash OBGYN associates that come to our Rocky Mount office every Wednesday to see the special patients that need to see a doctor.
I guess I knew that, but I just had not registered that. So, thank you for sharing that.
And we used to say we would do about 50% of the prenatal care of all Nash County. The privates handled all the 50. I'd say it's more like 40% of all the prenatal care comes through the Nash County Health Department, either in our Nashville office or Rocky Mount office.
Okay.
And it's so important that we get women in early on for prenatal care, the first trimester preferably, to get them in and get them established with maybe 9, 10 to 12 prenatal visits before delivery time.
Right.
And we coordinate that all with UNC Nash Hospital to make sure that maternity record's right there waiting for them when they go.
Well, and it is very important. If you've ever had a premature child, you certainly understand the impact of getting those prenatal visits in, and the survivability rate that is increased by that.
It really is. Infant mortality has been way too high, and neonatal mortality in the first 28 days does occur, and primarily occurs from low birth weights and premature.
Right. Well, my twin girls were born. One was born 2.5 pounds, and the other one was like 1 3/4.
Well, they were certainly in that
fit
category.
in the palm of my head. Yeah, head here and feet there, and it's amazing how small a baby can be.
Yeah, and some of those kids that are really underweight end up in the neonatal intensive care center over in Greenville with Pitt for several weeks.
But we ended up in Chapel Hill, so that was our story. But nonetheless, and that's when I learned how to fly, believe it or not, because I wanted to go visit my children every day, and so I decided to take flying lessons during that period.
And you're probably flying a Cessna?
I was flying a little Piper PA-28,
okay.
and it was a great little plane for learning, and anyway, enjoyed it.
Yeah.
So, on top of all that, I mean, you're providing physicals, immunizations, you're doing neonatal, maternity care,
family planning. We treat a lot of STD. We also, and just to mention that, we are seeing an increase in syphilis. I didn't think a year ago I'd sit here and tell you that.
Wow.
But we are seeing, we had 105 cases in 2022, and I looked at it the other day, we had 153 cases in 2023. So we are seeing an unusually high increase in syphilis, not just gonorrhea and chlamydia, sexually transmitted diseases, but syphilis that we also thought was going to be eradicated after penicillin in World War II.
Right.
But we're still seeing that. Incidentally, while I'm thinking about just this week, last week we had 2 new TB cases, tuberculosis.
Wow.
I will talk with doctors sometimes.
Active cases.
And active tuberculosis cases.
Wow.
Those 2 patients are at UNC Nash as we speak.
Okay.
But with every TB patient, just about, you have a number of contacts. So that's where we did 14 skin tests on that family household on Monday, which are to be read between 48 and 72 hours. So they came back in to be probably today. I did not get that the number if we got any positives. But we also had some to come in from the other patient's household today to be tested. So we simply do that
PPD.
skin test. PPD, exactly.
Got it. Mm-hmm. And then I guess that's positive. You do an X-ray or something.
If they show up, and of course we talk about positive converters. If they've ever shown a exposure with the PPD, they'll usually keep an exposure.
Right.
So it's a positive converter that we look at, and then we go for sputums and chest X-rays after that to get a more confirmed.
Well, hopefully
diagnosis.
nobody will show positive. Hopefully nobody will need that next step. And
that's right.
We can contain it where it is.
That's right. Hope so.
Wow, these are some old school stuff. You're going to tell me that the plague is nearby too? I mean,
the bubonic plague. I hope not.
I hope not either.
We found out years later it didn't come from the rats; it came from the fleas.
That's right. But anyway, so all those things. But you're also in charge of the veterinary services. We've got a new center at Wesleyan, and the health department does a lot with animal control. And so, I don't think folks really even know that.
Well, we're so proud of our Pet Connections and our new animal facility. We don't even call it an animal shelter anymore. It's a facility. It's like a Hilton.
Yeah, okay, all right.
Nearly. But we can house up to 50-some dogs and 50-some cats. We try to level off around 35 to 40, not to reach capacity if we can help it. But we are right beside the Nash Community College Vet Tech program. And that's not by accident. They needed some expansion land, and we needed a place for a location for a new $2.7 million facility.
I know. It's very nice.
And we got a large donation from the Dr. Nancy Shaw Trust through Dr. Dan Crocker.
I saw that in the paper. But, why don't you refresh that, folks, on that? Because that's really quite a story.
Yeah. Dr. Crocker called me one night at work, and he said, "Do you need a new animal shelter?" I said, "Yes, we really do. We've had it on the 5-year drawing capital outlay projects for a number of years."
For 15 years.
Yeah, maybe 50 years,
whatever,
and it's still there. He said, "Well, I might be able to help you. Do you remember Dr. Nancy Shaw?" I said, "Absolutely. She was a nocturnal hospitalist. She was always over at the hospital at nights, and I'd see her and sometimes walk with her. But cats would come out of the woods when she would drive up, really and truly. She fed cats all the time. She kept a number of cats at her home. She was just a very sweet, wonderful animal welfare person. But a long story short, he told me a sad story. She had been found in Valdosta, Georgia, dead, probably mauled by dogs while she was out. Her car was still running, and she was feeding what they thought were feeding cats, and she died in a ditch. But in her will, in a trust that was the administrator was back to where Dr. Crocker had worked with her for so many years. She had a considerable amount of money. But when Dr. Crocker said, "Do you need a new facility?" I said, "We really do." He said, "I think I might have some money for you." I said, "Doctor," I said, "you don't understand. I'm talking about $1 million."
That's right.
He said, "We can continue talking."
Oh, well, there you go.
I said, "Oh, now, when can we meet? When can I get you with the chairman and we meet?"
I'm available, right?
Yeah, I'm available at your convenience. We ended up getting over $1.5 million.
Right.
And that should have built the facility, but the COVID prices
Right.
got caught in with supply costs. We looked at the architectural drawing. We used architectural drawing that was over in Wilson County.
Okay.
The chairman, Mr. Robbie Davis, had strong connections with the commissioners over in Wilson County. We share things back and forth, but we were able to use that and also modify and improve some things that they had missed.
Okay.
So it gave us
you're right. You use a building for a while, you realize, wow, this little tweak would make all the difference.
And they realized it, from widening doors in the Sally Port to some different kinds of bathroom with cleanup area where the animal control officers come into the back rather than march through the front. But we really did make it out, and it ended up being about $2.7 million. But it is a nice facility, and I ask anyone who would like to adopt a pet. We use our rescue groups quite a bit. Shelley Milburn works a lot with us with rescuing animals, and we certainly welcome anyone to come adopt an animal.
So how does that adoption process work? I mean, I hear a lot from a lot of people, and I just don't know how I interface. If I wanted to go get a dog tomorrow, what would I do?
Well, you'd go out there, and you'd talk. You could call first, and we'd have an appointment for you, or just meet you out there and say, "Let us show you." Soon we will have a monitor in there. We have it already up there, but it's not connected. But a monitor that will show you our special. And as you sit and let us roll through and show you the very adoptable animals. Unfortunately, some animals, some dogs are very aggressive.
Right.
And we can't adopt them.
Which is why they're there.
Which is why they're there.
Yeah.
But many times we do have animals. And right now what we do is just walk our people through, our citizens through the facility and say, "Here's one of our very nice dogs."
There you go.
And a lot of them, quite frankly, we know of a case where people get sick or have to move, and they've really got nice dogs and cats, but they want a home for them.
Right.
And we have done a lot better at finding, so many people for years were afraid to bring the dogs or cats to the shelter because they knew it was automatic euthanasia.
Right.
But that's not the case anymore.
Right.
We really do try to adopt a lot out.
Okay.
That we can.
So I just show up, first come, first serve. I guess you maintain a list of something where if I said, "Hey, I'm looking for 1, 2, 3," and
or if you call and say, "I'd like a small dog, little dog," or do you have even pit bulls? We do have some nice pit bulls. Well, some of them, can be a little bit anxious and
just a lot of that's
show their teeth.
And how you deal with them, and how you treat them.
It is indeed.
And train them. So look, we've got the summer coming up here in the next couple of months. I mean, it doesn't feel like it today necessarily, but in 3 months we'll be complaining about the heat. So, tell us a little bit about what kind of relief services does the health department provide to seniors during the hot heat waves that we have or will be having upcoming here soon.
Well, let me say something about our swimming.
Sure, absolutely.
Our swimming pools also.
Oh, yeah, okay.
We inspect every swimming pools out there for the public. Not in your backyard as a residential pool, but even the Benvenue Country Club.
You also do wells, don't you, if I ask you?
We do well inspection, and it's required for a well permit and a septic tank permit.
Okay.
That's what our environmental branch folks do. But there's a rush on pools about a week or two before Memorial Day. Everybody wants to open, the hotels want to open their pools, the whole bit. So, but you have to have a permit each year to open those pools.
I did not realize that. Every year, I have to get
before
a permit.
they can open that pool, they have to meet those state requirements.
And so what issues are you looking at that would be waterborne transmitted, I guess, is really what you're looking for? I mean, what are you looking for?
Well, we're looking for the pH and looking for them to keep a log and make sure they monitor on a daily basis.
So limiting bacteria growth, I guess.
That's right.
Okay.
And I'll tell you something years ago that I got into, and I could name some places, but I'll name one. Benvenue Country Club had a diving board that was too high for the depth of the water.
Mm-hmm. I remember that diving board.
So and lots of kids trained on it, and later became good divers and the whole bit. But it needed a greater depth. It needed 12 feet of water with the height of that board. Now they knew it was a lot easier to lower the board than to make that pool deeper.
No doubt about it.
So, but that became a rule because we saw too many broken necks. Not. But you just don't want any. But you'd see a broken neck occasionally that would occur from the depth of the water when the pool was more than a meter off the water.
Wow.
Yeah.
Wow.
So that became a state regulation. But as the summer comes in, the Social Services Department certainly has some fuel, as they do in the winter, some money for the low-income citizens to have heat, have electricity connection, and, make sure they can maintain that in the winter months, but also fans available. But we do certainly, as we get into the really hot summer months, especially for folks higher risk like senior citizens, to stay hydrated and to stay out of the peak hours of the hot sun and stay in as cool as they possibly can.
Right.
Because we still see heat stroke. We still see problems with heat-related illnesses. I think we especially see it in the fields with migrant farmers sometimes.
Right.
And I believe we had a death last summer with a migrant farmer.
Well, it's not hard, really isn't. If you're not hydrating, and it's so easy not to.
It is so easy not to. I think in the School of Public Health one time I was told if you become thirsty, if you're ever, and we all get thirsty, but you waited too long to drink water.
Okay.
You really shouldn't ever be thirsty if you're staying adequately hydrated.
Well, you know what? I'm going to put that in my Rolodex of things to remember.
I try to remember it myself. I look at my sodium levels in blood, and the more water you drink, you can lower that sodium. You don't lower it too much, but you can lower it a little bit. And I can tell I stay hydrated, but I'm trying to do the same thing.
Well, look, these are all great tips, and we've run out of time. And I want to thank you for coming. I tell you what, it's always a joy to chat with you, and I always feel like we haven't allocated enough time.
I know. We could do this a long time, and we did it on the John Checkney show.
Yes, we did. Oh, that's right. We did. You and I were both there.
We were
during the COVID period.
During the COVID, we kind of were co-host, I guess,
or guests, or whatever you want to call it.
Yeah,
I don't know.
That night. But I appreciate it, and I also would be remiss, Mr. Mayor, Lord Mayor.
Oh, Lord.
by saying we all appreciate the leadership you provide for our largest municipality in Nash County.
Well, thank you so much for that. Thank you for coming and all that you do.
Thank you, sir.